These are the foods that you should never eat or drink if you are taking any of these types of medications. The very first one, which I find is pretty interesting, and it's something I always have to tell my patients and clients to be careful about, is about grapefruit. I mean, we love grapefruit, but taking grapefruit or any grapefruit juice, it has been shown for a lot of medications, especially for like blood pressure medications, for cholesterol. I mean, you name any kind of medication, because what grapefruit does, it can enhance the effects of that medication. Now you might think that's great. It can enhance the effects of the medication, but it also can cause damage to the liver because it's increasing the effectiveness of the medication. And so therefore it could cause some other serious health issues that you need to be careful about. Now, the second food that you need to be careful about, if you're specifically taking MAO inhibitors, which are typically used for an antidepressant helping with depression, or sometimes can help with the symptoms for people who have Parkinson's disease, you should probably be really careful about these particular foods. And the foods that I'm referring to are like pickled foods, cured foods, fermented foods, any foods that are considered high rich in tyramine. And why this is so dangerous when you're consuming these types of foods, it does interfere with the breakdown of tyramine, which is an amino acid. And when that happens, it can lead into increased levels of tyramine in the bloodstream, which then can lead into increased levels of blood pressure. Now, some other common tyramine-rich foods, things like chocolate and also like processed meats or like aged foods like I talked about, or any kind of like soy products. So if you are taking these medications, definitely talk to your prescribing doctor about how to schedule when you need to be taking the medication, and especially if you want to eat these types of foods. So just be careful with that. Now, a third food that can interact with medications, and this is a very common medication that a lot of us tend to use if we need to, is taking antibiotics. Antibiotics is used for a variety of different things. And so if you are taking antibiotics, the thing you have to be careful about is dairy foods, especially dairy foods that have high amounts of calcium. And the reason why this can be a problem is because there's some antibiotics, when you have something that has high amounts of calcium, such as like some dairy products, it can interfere with those antibiotics and actually can decrease the effectiveness and the absorption of that antibiotic you're trying to use. Now, the fourth food that you gotta look out for is leafy greens. Now you might be like, wait, Dr. LeGrand, I mean, yes, of course, you wanna be taking leafy greens. And the reason why this might be a concern is because leafy greens have vitamin K, which is very vital for the production of clotting factors. So that is absolutely necessary. But if you're taking medication like warfarin, then you gotta be careful about how much vitamin K you're consuming on a day-to-day basis, because warfarin is an anticoagulant. And so that's going to interfere with high levels of vitamin K, and it's kind of doing the opposite thing. And so therefore vitamin K can interfere with this anticoagulant, antagonizing it, wherefore will prevent warfarin from being effective. If you're new to this channel, then you should hit the subscribe button, because we talk all about brain health and ways to improve your health optimally. So go ahead and hit the subscribe button. Now, the fifth one, this is probably pretty obvious for most people, but I want to explain really why you really need to be very careful about this. And you've probably been told when you are taking medication, you should not be mixing it with alcohol. Even a couple hours after drinking alcohol, you should be really careful. And the reason being is because the mixture of any kind of medication, especially like blood pressure medication, and you mix it with alcohol, it can escalate the effects of that medication or even also the alcohol. And so what that can do, this can lead into internal bleeding, heart problems, and even difficulty breathing. So definitely be really careful about when you're taking your medications if you're going to have alcohol that day. The sixth one has a lot to do with if you are someone that is taking Adderall, Ritalin, some kind of ADHD medication, you have to be careful about taking something like orange juice or any type of juice that has high amounts of vitamin C in it. And what this does, it will decrease the effects of the medication. So if you're planning on taking orange juice that day or any kind of juice that has high amounts of vitamin C, definitely take it several hours apart, so that way your medication will still be working for you. And number 7, I find this one pretty fascinating. You probably like licorice. I mean, I like licorice. And it might be a great snack or a great treat to have. But if you're taking any kind of blood pressure medications or a diuretic, or if you have like congested heart failure, there's certain medications that this can be toxic with when you're taking licorice. But with the high blood pressure medications and diuretics, licorice can decrease the effects of it. So definitely talk to your prescribing doctor about any of these types of medications to just make sure you're not taking them close to it, or if you should be avoiding it altogether. But there's also other medications that interact with, for example, supplements. So if you are taking supplements and medications, then you should watch this video next, where I talk about the supplements that you should definitely not be taking with your medications. So watch this video next.